Hi, my name is David Borst, and I am presenting the occupation of brushing teeth. I chose to present about this occupation because the population I observed consisted of an adult who suffered from falling down a flight of stairs, and he had a wrist fracture in his right wrist. After surgery, he decided to attend OT. One of the client's goals is to be able to brush his teeth with a full range of motion. Other diagnoses this occupational therapy could accommodate for include radius ulna fractures, cerebral palsy, carpal tunnel, and tendonitis, and also arthritis. For the purpose of this presentation, I will be representing the occupational therapist, who looks like this, and the role of the client. And for this presentation, we're going to call him Bill. And he looks like this.
Hey, I'm Bill.
So, to begin the area of occupation of brushing teeth, according to AOTA's Occupational Therapy Practice Framework, Domain and Process, 3rd edition, it is considered an activity of daily living, and it's classified as a personal hygiene and grooming activity. So let's start with the client's occupational profile. If I ask the client, what is the purpose of the occupational therapy, and what concerns do you have that's relative to engaging in activities and occupations? He may respond with something like this.
Well, David, the purpose of me coming to OT is to restore my range of motion and to really strengthen my bone and muscles in my forearm and wrist. I want to alleviate the pain and engage in the occupation of brushing my teeth to the best of my ability.
Bill, what is your occupational history?
Well, actually, I'm a chef owner. I am right-hand dominant, and I consistently use my right forearm and wrist to pull open cabinets, maneuver kitchen supplies, and chop up food for the customers. Before I can get to work, however, I would like to be able to have a clean smile and proper hygiene so I don't scare off all the customers. You know what I mean?
Well, thanks, Bill. And I'd be happy to help you get to your full range of motion as best that we can. So, class, what you saw here was a brief occupational profile example. Now, to analyze this client's occupational performance, I would gather more information about the client. I know now that the preparatory, purposeful, and occupation-based activities should render occupations as close to the natural environment of not only the bathroom setting, but also the client's work setting. Throughout the client's performance in OT, I would record his progress with an instrument that measures the angle or an object to be rotated to a precise angular position, and this is called a goniometer. In OT, this tool measures a range of motion, or axis, and is used in subsequent interventions. It looks something like this. So now it is time to develop the intervention plan and to implement intervention. First, I would like to focus on loosening up the muscles and joint stiffness of the client's forearm and wrist. And I would have Bill perform some preparatory activities afterwards before having him engage in the purposeful and occupation-based activities. Alright, so Bill, what I would like you to do for the first couple of minutes is to place your affected right forearm into the warm paraffin bath, which you see over here. Rotate it. Okay. And this activity will allow your muscles and joints to loosen up, and it will depress the pain. It will increase your blood flow, and it will improve your motion during the activities. I'd also like you to gently tuck and turn your phalanges into the soft sponge which you see in the bath here. And this will work on strengthening your grasp. So now we're going to work on some synovial joint movements, which will help improve your range of motion when performing activities. The area of occupation these activities will help in are activities of daily living, so brushing your teeth, for example, and your instrumental activities of daily living, so your meal preparations, and occupation-based activities. Bill, let's start by having you take your right wrist, and we're going to perform what's called a flexion motion, where you decrease the angle of the wrist, and then we're going to transition into a hyperextension motion, where you increase the angle of the wrist. This will help you when you need to move the toothbrush around in your mouth, like that, or when you pick up objects, or when you pull on handles for your drawers, your kitchenware.
Okay, sounds good.
Great job, Bill. You're doing good. So now that Bill has worked on his flexion, extension, and hyperextension of the wrist, I would then record his progress by recording the angle of his range of motion with the goniometer, which I mentioned earlier, before continuing to the next exercise. Okay, so Bill, I would like you to work on some abduction-adduction movements of your wrist, and I'll demonstrate this for you. This will help your range of motion while you brush the surfaces of your teeth and chop up food. Alright, Bill, so just watch me demonstrate. Okay, so as you can see, this is like a motion you would do when you brush your teeth, you know. And then after about 1 minute or so, we'll go into the opposite. You're going to flip your wrist around like this and do the abduct and adduct movements.
Okay.
Alright, excellent. Alright, Bill, so to strengthen your grip, we'll perform some flexion, extension, hyperextension of the phalanges, your fingers. So next, I would have Bill tuck and turn his phalanges into a Alright, so after Bill performed the flexion, extension, and hyperextension of the phalanges, I would move into another preparatory activity, which would involve a tucking and turning of his phalanges into a ball of clay. I don't have clay with me, but just imagine. And to modify this activity, I could use a sponge that's soft, so you get more grasp out of it. And that would actually, it's also grading the activity because you're requiring more strength. Initially, I would have used the clay ball, then we would transition into the sponge ball. Or I could move from a larger clay ball, where you're doing very little pressure, to a smaller size ball. So just take some clay, remove some clay to make it smaller. Alright, so after that, I'd move into I would have Bill work on some manipulation boards, which will aid Bill in performing tasks such as turning, pulling, rotation, and it will help him to increase his functional mobility when transitioning from room to room or when operating the drawers, when he has to pull the drawers open. The turning aspect will come in handy when Bill needs to screw off the toothbrush cap, the toothpaste cap, or the mouth freshener caps. Alright, so switching environments. We're now in Bill's natural environment. Now that Bill's blood flow is flowing, he's all pumped up, he's ready to move on now to the purposeful activity or and also the occupation-based activities. For the purpose of this demonstration, as I mentioned, we're going to show this in Bill's natural setting. This is his bathroom. If I were in a clinic setting, I would use objects which resemble the supplies required for this activity, and I may have Bill perform simulated or contrived activities. So take a look at the supplies required for this occupation of brushing your teeth. Okay, so to measure the occupational performance of Bill, I would develop a monitoring chart for each session, and I would encourage him to keep a chart of his own so that he could monitor his progress. And also, if he wants to keep the steps up for the activity, he can do that too. By having a monitoring chart for each session, this would allow me and Bill to evaluate his weaknesses, his progressions, and it'll allow me to modify or grade the activities so that we can progress as we go along. And it would help strengthen Bill's independence and help him restore his range of motion. So Bill's coming in now to perform the occupation-based activity, and he's following the steps. He's getting out all the supplies from the drawer. And during this activity, you'll notice he'll be using a lot of the flexion, extension, hyperextension motions that we used in the preparatory activities. So now he's just rinsing off the brush. And notice that he's holding a modified device. It's a built-on grip. This will help his grasp, and it won't require as much force and much closure on the actual grip itself. So now he just cleaned off the surface of his teeth. Now notice he just switched his wrist there. Now that's adapting the activity. He's allowed to do that. If he's experienced too much pain, he has limitations with pain in ROM, so he can do that. Now he's just finishing up, rinsing off, using the cup. And he's just checking out the steps, wiping the mouth now. And in here, notice that Bill has the monitoring chart, which we discussed earlier. This chart will help both me, the OT, and the client monitor the progression and the weaknesses of the client so that we can just talk about it at each session and work on ways to improve. So now for some modifications, we'll notice that Bill will now use an electric toothbrush. And the purpose of this is to alleviate stress and force on his muscles and bones. With the range of motion, he won't use as many synovial joint movements. It's really a press of a button. You have different modes, and you're not exerting as much force onto not only the wrist, but on the surface of the teeth. And here we'll see the different modes on this toothbrush. There's different vibrating modes. Basically does the work for you for the most part. It still requires some synovial joint movements, however. And he's just following the same steps as before. Rinsing off the brush, turning off the water, putting away the supplies. So you'll notice here I developed this plumbing fixture device for OT where I shoved in a face towel and it's snug against the toothbrush. What this does is it's a built-on grip for the client, and so he doesn't have to grasp as far in as before, and it will help his strength and development. You can easily loosen and tighten this device, which is good. Hello, this is David. Oh, hey Bill, how's it going? Oh, your business is going good? Oh, excellent. And how is brushing the teeth going? Haha, you haven't scared away any customers. Good. All right, Bill. Well, it's good to hear from you, and I'm glad you're doing well. Take care. Bye.